We have our patients over here. You wrote them down. I want to know between the 17-year-old screaming with contractions, this 39-year-old grabbing a one pair zero here for the second time, talking about she ain't got no movement, from the 28-year-old at 26 weeks that fell on the ice to the 22-year-old who is bleeding with intercourse after intercourse at 19 weeks to the 15-year-old who is crying and she is having abdominal pain and spotting at 9 to 10 weeks. Who are you going to see first? 1, 2, 3, 4, 5. Name a number, not a person.
Can I see?
The number, not a person.
Can I see? I didn't see number 3.
3? You want to see 3?
I couldn't see.
And 2, the colors are different, so count. Which patient?
I was still over there. That's why I moved over here.
Oh, you couldn't see that one?
Yeah.
Okay, which one you want?
I'm trying to see.
Well, sit over here for crying out loud. Like, what the fuck? This is what? Come on now, I can't move. You gotta move. Okay, come on, baby. What you got? You should sat there anyway with your cute tummy self. What you got? You got cousins over there that could deliver your baby if you start some shit. How many weeks are you?
31.
Oh, that's a good age. That means everything is going good. At 31, I used to tell my patients, you're good. Just need to cook a little longer. Everything formed.
Yeah. I'm gonna go with 5.
You want to see 5? Okay. What do you want? Who do you want to see first, baby?
Go with 5.
5. How about you, Nakaya?
3.
3. What do you want, Nadia? Nadia, don't kill me. I know, girl. I got an 8. What my girl that sits over here with y'all? That's called a day. I don't know where she at.
2.
2. Okay. Who do you want to see first, D?
3.
3. How about you, Essence?
3.
3. Okay. Somebody got it right. A couple of y'all, I believe. Did I get everybody? Raise your hand if you said 5. Very good. Now you have to tell me why, and whoever gets the why correct wins the case, right? Okay, so, we forgot to do our round table. Essence, start your round table over there so everybody know everybody.
I'm Essence. LaShonda.
D.
Nakaya.
Lauren.
That's why I keep calling you crazy, because I forgot to have y'all do a round table. Nadia, my baby. Okay, so Lauren and LaShonda, because you be sitting with Tashonda fucking me up. So LaShonda and Lauren got it right. That's pretty impressive. Now Lauren get an upper hand because she got a baby in the belly. She ain't playing with these pregnant ladies. She like, look, we pregnant. We know pregnancy. If we don't know nothing else, we know this pregnancy. What do you think this could be, Lauren?
Why do I have a brain fart and my brain won't work?
That's okay, because we know placenta brain.
I'm gonna call it the tube baby.
The tube baby, she said. What do you think it could be?
That one.
Okay, so you both won. So we're gonna double team this patient. Okay. Remember, everyone, when you win the patient, you gotta handle the business. So you're gonna tell me everything you would do. First nursing action. What you anticipate the labs being, what you think is going to need to happen with this patient, how you prepare her for the plan of care the doctor has, any testing that needs to be done or procedures. You ready? Let's go. What is your first nursing action, Lauren? With this 15-year-old crying at 9 to 10 weeks, complaining of abdominal cramps and spotting that you think could be an ectopic, and so does LaShonda. What do you want to do first?
I know you first gotta get vitals. That's usually the first thing you already had did.
Do you agree with that, LaShonda?
No.
What would you do first?
I would get a pregnancy test.
Okay. She's pregnant. It says it right here.
Okay.
What are you doing?
I would get an ultrasound.
Okay, so you're not an ultrasonographer, so are you saying prepare for
Prepare
the ultrasound?
ultrasound.
Okay, so you said vitals, you said prepare for an ultrasound. One more thing should have been done. D.
Call a doctor.
Nope, that ain't first. You know Reese's ain't this. What would you do? Cause Lauren is right, but you got one more thing that needs to be done. You remember?
Yeah, she's 15 years old, so you would have the mom for consent.
Well, it's an emergency, but you're on the right track.
Okay.
Lauren said get the vitals, but we got something else. Micaiah,
Surgery?
you doing surgery now? Okay, I'm done with you. Micaiah, what did you say, Essence?
Wait, she said
vitals?
ultrasound.
She said vitals.
Oh, vitals.
Yeah, she said vitals. So you know all pregnant women get vitals first, so she good. But we need something else. That's what?
Maybe
Screen.
maybe I was gonna say a fetal heart.
Hey, baby. Okay. Y'all gonna get a whooping. If this is truly an ectopic, which the two babies thought it was, isn't it a medical emergency that could kill both of them?
Yes.
Think like that. What do you want to do with this patient?
No,
You ain't dead. You're gonna be mad at me if I say it.
Don't say it.
I ain't gonna say it. I'm trying not to, but y'all being goofy today.
You're gonna have to get the blood, like, see.
Get an IV started.
Thank you.
Okay.
Life saving. Gonna die. Ectopic. Need a fucking IV as somebody's getting vitals. Like, I mean, like really for real. Because an ectopic, oh my God, it don't take long to kill you.
I should have known I had it before.
Oh no.
They removed my fallopian tube. And
So
they had to do a
tell the
DNC.
class how it started. Like what happened that day? What did you feel?
So I
What
had
was
real
going
bad
on? How
pains
far
on my
were
right
you?
side,
You
and
had pain on the right
on
side.
my right side. They removed my right fallopian tube, and I had real bad pains. And when I first went to the doctor, they took a pregnancy test, but the positive test didn't pop up right away.
Okay.
It came after they let it sit. a
Did they
little
do blood or urine?
bit. They did urine.
Okay, so you didn't know if you were pregnant in this
I just
scenario.
had pregnant symptoms.
Okay,
And
so
I
you
didn't
hadn't
have-
really done
I
a
didn't have
test.
Period. It was just kind of like.
Now, okay, so they did the test and it really wasn't positive initially.
Yeah, but then after a while, when they checked back again, they second checked, it showed the positive from my hormones. I
That
guess-
was blood.
Yeah.
Okay, because it makes sense that the urine test that they do might have been faint because you're losing the baby.
Yeah.
And that the blood test was like, oh yeah, something's going on. So what did they do? Was that at the ER?
Yeah, they admitted me once they got in, but they gave me two options. Well, to see how far I was, they took the blood. Then they gave me two options once they felt like that I was pregnant. They gave me an ultrasound to see where it was at. They noticed it was in my tube. They gave me an option to take a pill, and they gave me. Well, that was the first doctor came in, but the next doctor that came in seemed like she was more on top of it. She said, "No, she's too far along. We need to get that out of there."
Okay,
And so
okay.
and
That doctor ended up being correct, by the way, because that was evidenced by you losing the tube. The baby was big enough to make you lose the tube.
Yeah, and it ruptured a little bit.
I'm sure.
So they had to remove it with a DNC, but
Not a DNC.
I mean,
Because what's a DNC, everyone? That was one of the test questions. That's one of my little case study questions. What does a DNC stand for? D and what? D and C stands for what? Because women mess this up a lot.
It makes me think D and
I heard it.
Dilation.
Dilation and curettage of what body part? Dilation of the
Cervix.
cervix,
curettage or scraping out of the
cervix.
uterus, right? Think about your body parts,
Okay, so
ladies.
what was-
Woo, we're gonna
I
pray
can't
about
even
it.
think what it was.
So let me explain what I mean. If you get on this NCLEX exam and you click D and C for this patient, they'll know you're not thinking of organs in your body correctly. They'll know you don't know the anatomy Because if the baby's in the fallopian tube, you dilating the cervix and scraping out the uterus would never get the baby.
Okay.
Okay, so what we say for this one on your test, and yes, you have to know it, is that this patient needs a laparotomy.
Okay.
That's what's on your test. Now remember, just because you guys sometimes don't know the rules and we got new people, when you're in toe-to-toe like we are now, shh. When we're in toe-to-toe like we are now, remember you can't raise your hand, nod your head, even speak at all unless it's the person with that disease. Right, y'all? Okay, so you got it. It's your disease. It's both you and Lauren, because Lauren hit the nail on hit it on the jackpot when she said the vitals, because all pregnant women get vitals first, and that's not true for any other person on NCLEX. Let me say that again. All pregnant women, so everybody in this little section gets their vitals taken first, but you got to remember it's not as simple as vitals. What's included in vitals for the pregnant lady, Lauren?
Okay, it's the blood pressure, fetal heart rate, the pulse,
Blood pressure, fetal heart rate, pulse, temperature,
and
Wait.
weight is not a damn vital
No,
sign.
not
What the fuck?
respiration.
Get my belt.
She said respiration.
No.
What'd you say, baby? Respirations. Yeah. So remember, it's your regular vital signs that you're used to, but sometimes if you've been an aide before, you'll mess this up. What did I tell you was not a vital sign, but aides always throw it in there as one.
Okay.
Pulse ox. Yeah, remember you always throw that in, because when you do the vitals on people at work, you get that up there as well. That's not part of vital signs. Part of vital signs, and I always just say TPR and BP. That's how you got to remember. TPR and BP. TPR and BP. Temperature, pulse, respirations, blood pressure. TPR and BP. Now, because they're pregnant, you get a, like you said, a fetal heart rate. There is no fetal heart rate in the uterus on this one. It's in the tube. So far, you guys, just to put it, clarification, because we had a baby that had an ectopic pregnancy, nearly lost her life. We want to make sure you understand what we've done so far with this patient. So far, we did all 5 vital signs. So far, we have agreed that she needs an IV. These two, Lauren and LaShonda, have the patient. So Lauren, you're going to start this patient's IV. What gauge needle will you use for this patient? She's like, I don't want to start the IV.
I said 24.
Okay, you want to do a 24? What gauge needle do you want, LaShonda?
I'll do 22.
22. What gauge needle do you want, Nadia?
20.
What gauge needle do you want, Nakaya?
22.
What gauge needle do you want, what's that child's name, D?
22.
What size gauge needle do you want? Baby, what's your name again?
Jordan.
Jordan, what size gauge needle do you want for this patient's IV?
I want to say 18.
What size do you want, Essence?
22.
Okay, the new baby got it right. That's why I say you can be new. Come on up in my house. You fucked it up. So she got it right. Now, why did you pick an 18?
Because the way I was thinking, like any emergency, you want to hurry up and get 18 because it's going to flow faster. Like,
No, you said it.
Blood is thickening.
Lauren said it best. We're at risk for hemorrhage. We might need a blood transfusion. Blood is thick. You need a big needle. It's not the emergency, because that changed. All the rules changed on IVs. So if your school told you something crazy, you know I'm here to straighten you out. The reason why you need an 18, and you're going to need 2 of them, is because she's already bleeding, most likely going to be hemorrhaging. With an ectopic, that's how you lose your life. You hemorrhage to death. Now, what do you think her vital signs are, Miss Lauren, if she's truly an ectopic?
I believe the blood pressure might be.
Y'all get ready to rebut. Whatever she say, you got to write it down.
No, high, but
I didn't hear you.
high,
I didn't hear you.
high.
High what? I didn't hear you.
Blood pressure.
Blood pressure is high.
Yeah,
Okay. Pulse.
high.
Respers.
High.
Temp.
It could be high.
Okay. Now, so you get to do a rebuttal. LaShonda, what did she say that you don't like? That's what a rebuttal is.
She said that the temp is high. I think the temp is within normal range.
Okay. All right. And why?
I just don't feel like her temp will be elevated with this.
Because she doesn't have a what?
Fever.
A fever or infection.
Infection.
Just the proper answer was an infection. Okay. What else? Give me some rationales for whatever else you got going on.
She said that the blood pressure is high. I agree with that.
Then don't tell me about it.
Okay.
I only want to know what you disagree with.
Just the temperature.
That's it? That's the
Yeah.
only one you disagree with?
Yeah.
Okay, let's do a rebuttal over here. Nadia? Do you have anything that she said that you disagree with that wasn't already said?
I disagree with the blood pressure.
Why?
I think the blood pressure is low
Why?
because the patient is bleeding.
What difference does that make?
Because, like,
Because she could have said it's high because the patient's bleeding. I mean, anybody could say that. Give me some pathophys. What's the pathophys behind it? You got this. You already got it. You know it like you know your name, so handle it. What is it about bleeding that makes blood pressure low in your mind? D, help her out. She on the right track. Find a train.
When you're losing fluid or losing blood, your blood pressure will drop.
Okay, so what I want y'all to get good at, 2 different things for blood pressure questions on NCLEX. If you think the blood pressure's low, be ready to talk about the loss of fluid or blood controls your blood pressure, right, baby? So if you lose blood or you lose fluid, you're going to lose your blood pressure. It's all about volume. Volume of fluid controls the blood pressure. So you know you got your shit together, you fine. Now, the second thing you might have to say on the test, because maybe it's not a volume issue, it is with this patient, but maybe it's somebody else with another condition. The other influencer of your blood pressure is vasodilation. If you vasodilate, the blood pressure drops. If you vasoconstrict, it goes up. Those 2 things, just remember your patho, okay? All right, so you are right. Blood pressure's low, temperature's normal. Any other rebuttals for Lauren? Or is she correct in saying that the respiratory rate and the pulse rate is high?
I have a question.
You don't ask questions in the class. You will see, this is different from class, baby.
Toe to toe.
Yeah, it's toe to toe, it's different. What you say, anybody else? Y'all got anything that y'all want to rebut? She's good then? You agree with the high pulse and the high respers? So do I. Why, Lauren, is she breathing a little faster than normal? What is your rationale for that answer?
Probably for the pain. Well,
Could be the pain or just anxiety, or maybe she's even losing blood internally that we don't see yet because it says spotting, and she needs oxygen, and so she's breathing faster to get it. What about the pulse? Why do you think the pulse is high?
probably the same.
Same when you're losing blood, and this is the answer on your test. When you are hemorrhaging or losing blood, that pulse rate increases to compensate. It's kind of like you losing the blood, so the heart is like, oh my God, really? This is what we're doing today? Let me help you with that. Let me increase your heart rate to get more blood to tissue. So it just picks up the beat a little bit to get more blood to tissue. Okay, now, what procedures and labs do you expect to be done? Lauren, it's your disease and LaShonda's disease. Y'all handling the business today, doing well. What labs would you like, darling? Remember some of the ones we did in the last toe-to-toe. So there are a lot of times the same damn labs every time we do a toe-to-toe.
Right. I keep getting those two mixed up.
That's okay. We'll get you together. LaShonda got your back.
I'm not gonna need like a CBC.
There you go. Start there. That's what you always really want to start with, everyone, when you're a real nurse. Get that damn purple top tube, okay? So the CBC has what 3 labs that you want to look at for this patient?
The H&A.
Yep, H&H, hematocrit and hemoglobin. Well done. What else, baby?
And a platelet.
Platelets, because maybe, again, everyone, a complication of hemorrhaging is DIC. We could be going into some serious trouble with this ectopic. There's one more lab that's in there that I think we might look at just to make sure what the baseline is. What was the other lab in the CBC? So far you got hematocrit and hemoglobin, which we call H&H. We said platelets. There's one more. Remember the flag colors. That's how I teach you to remember this.
Flag colors.
Red, white, and blue.
What are the white blood cells?
White blood cells. So we tell you with the CBC to remember flag colors, red, white, and blue. Red for the H&H, white for the white blood count, blue because that's what color you're going to be if you have low platelets, okay? Bruising, okay? Now, the key with this patient, with those 3 labs, I'm not mad at Lauren for saying that the temperature might be high. It's probably normal, but one situation where it would be high is remember that she's pregnant, and if her tube has ruptured, it's in the GI system. I mean, it's right next to the GI system, and all GI is dirty. So a perforated fallopian tube can easily become a peritonitis or an infectious issue. So it would be wise to look at the white blood count and see where she started at. Does that help a little bit? Okay, you guys, you're doing good. Now, you did a CBC. LaShonda, what other labs can we do?
BNP.
A BNP. And what does a BMP stand for?
Basic metabolic panel.
Basic metabolic panel. What labs in your basic metabolic panel do you want to look at? She gonna get a whooping.
I just want to think.
Okay, Lauren, help her out. What labs are in a BMP? Y'all handling the business. Oh, she stole her shit back. You know how they get. They get a little touchy when I take it back. Oh, okay, baby. What'd you say now?
Creatinine.
Okay, so we got 2 labs that always go together. Creatinine always goes together with the. I know you ain't talking.
Oh shoot! I thought you said
This is
that.
toe to
I'm sorry.
toe, honey.
Oh right, okay.
Yo ass.
I'm sorry.
My
Now you
people.
tiptoe around.
My people.
BUN.
Okay, BUN and creatinine. So what do we say about the BNP? We say that's renal function. Okay, that's how I need y'all to handle this. BUN and creatinine is renal function, right guys? Okay, what else is in a BNP, Missy? Quit writing. You slowing me down. What else is in a BNP?
INR.
Hell no. Lauren, what's in a BNP?
Shoot. Okay.
Electrolyte.
Why you fucking me like this?
I
I be getting stuck. You make me nervous.
You are hilarious. So let me just explain what's going on in my class. As soon as I take her disease away, she suddenly got the answer. Y'all, this is how my life be.
My head don't click like that.
Don't nobody want to hear that shit. Okay, baby.
You make me nervous.
I make her nervous. That's highly likely. I make everybody nervous. Okay, so baby girl, are you with me or not?
I'm with you.
Okay, so here we go. BUN and creatinine. You said electrolytes after I stole it and gave it away. Anything else you want to say before I steal it and give it away?
So do they still do the ultrasound?
I ain't asked you nothing about no damn. I'm on BNP.
Okay.
Oh my God.
No, you can give it away.
Oh, I can give it away now? You better not say shit when I do.
Okay.
Okay, Lauren, is there anything else in a BMP, a basic metabolic panel, besides BUN and creatinine, which is renal function, electrolytes? Is there anything else in that BMP that we might be looking at, or just always in a BMP?
I don't know, but I might just say something crazy. And if
Don't say nothing crazy. We don't know. We don't need crazy. Nadia, do you know? That's a yes or no,
That's
baby.
it.
Help me out. Nick, why would I? This what I do. So if I'm going around asking you for something else, it ain't it. Nick, they on trash today. I don't know what's happening in my class. Nikaya, yeah, y'all is. Y'all on trash. What you got? What else is in the BNP? I know Essence knows. What you got? Thank you. Okay, shut up.
I said it. Okay. I be having to think. I don't know.
Oh my God, I love me some LaShonda. She figured it out after Essence said it.
No, I said it before, didn't I?
Yeah, that's what I mean. That's what I mean. You was right with it. Okay, so listen, everybody. So far, y'all funny. So far, we have a CBC, a BMP. Is there any other? This is my babies now. Don't be shouting out shit. This is my baby Lauren and my crazy baby LaShonda. Is there any other labs for this patient, Lauren?
type of screen.
Woo! Get it, girl. Get it, girl. Get it, girl. Should she do a type and screen or type and cross, Lauren? And what's the difference? Oh, she gonna take it because you on some trash.
Yeah, go ahead.
Oh, no, I thought you was talking to her. You
I
said
say
no.
LaShonda.
Oh, okay,
You know what?
I
I
think
told
type and
myself I was
cross.
gonna figure it out.
You think she should do a type and cross?
Type and cross.
Either one of
yeah.
y'all can answer it. I don't care.
Just because the baby. I mean, type and cross.
Why should she do a type and cross? Why should you do a type and cross?
I don't know. I was just trying to figure it out the other day.
What's the difference, Essence? Help them out.
Type and cross. I think you should do that one first because I think it takes longer.
It prepares the blood. In other words, a type and screen is perfect for anybody in this section. A type and cross goes a little bit further and tells the blood bank, I'm pretty sure I'm going to transfuse this lady. Just have 2 units ready. Okay, so it takes the same kind of test, gives us the blood type and the RH, which is a Coombs test. It gives us the type, the RH, the antibodies, but it goes a step further in the sense that we're gonna be preparing some units that match this patient's blood. So it's a type and cross match. That's what the difference is. Okay, type and screen is more routine. That's the rhyme I teach you. Type and screen is more routine. Okay. All right, now, procedures. What procedures are we, my bad. Are there any other labs? Because there is. Are there any other labs that you want to do, Laura?
Anyone else?
Mm-hmm.
PT and PTT.
No, this is not a clotting issue, but what I would do is a serum quantitative HCG. So I would do a blood pregnancy test to follow her HCG levels. Does that make sense?
You said it
So
again?
you said serum.
Just a quantitative beta HCG. So it's not a urine pregnancy test. Once you see on the test quantitative beta, and they will spell it all the way out. And they'll say they'll say quantitative beta, and then they'll say human chorionic gonadotrophin, like crazy spelled out. So annoying. Okay, so HCG stands for human chorionic gonadotrophin. It's crazy, fucking crazy. So anyway, that's what I would add because I'm gonna need to follow her HCG levels, okay? All right, so what procedures will be done for this patient? We already said, and I hope you wrote it down because that's what you're doing, taking notes so you can put them in your packets later. We already said that this patient gets a laparotomy, not a DNC. What other procedures, and you kind of mentioned it with your personal story, what other procedures should we anticipate being done on this patient? Either one of you two.
She said ultrasound, right?
Yes, and ultrasound. Will it be transvaginal or will it be abdominal? Transvaginal. And what preparation needs to be done for a transvaginal ultrasound on this patient?
She need to empty her.
Empty the bladder.
They need to empty their bladder, not fill it. So if you're doing an abdominal ultrasound, you fill the bladder. If you're doing a transvaginal ultrasound, you empty it. Something else I want to remind you guys, because I forgot to tell you. I know you old school know. Make sure you record this lecture, right? Okay. All right, so anyway, your 15-year-old crying at 9 to 10 weeks, complaining of abdominal cramps and spotting, you guys have decided that it's a potential ectopic. Because of that, you want to go ahead and get all 5 vital signs and even check for a fetal heart rate, which you did not get in the abdominal area. You wanted to make sure you started an IV because an ectopic is life-threatening. You anticipated the doctor ordering a CBC, a CMP, a type and cross, as well as a quantitative beta HCG. You have decided that this patient needs a transvaginal ultrasound, so you're going to make sure before that procedure is done that she empties her bladder. Let's talk more about that IV. What, I don't know why y'all talking. I have no idea. What is the name of this IV on NCLEX? What will it say on NCLEX? How will it be described? Either one.
Peripheral,
PVAD, so
You not even in this conversation, boo. You was late. You not part of this dance. Just sit there with your little pretty hairdo and chill, okay? Just relax your mind. Let your conscience be free, okay? Go ahead. LaShonda, always late, but good. Peripheral vascular access device. You guys said you wanted an 18 gauge because we know that this patient's at risk for hemorrhaging and her blood is thick. We said her blood pressure's low. We said her pulse is high. We said her respiratory rate is high. Her temperature is normal. We got this. Now you got to finish this IV. Lauren or LaShonda. You got an 18 gauge angiocath. You are ready to go. What angle should you insert it at? Lauren? 15 degree angle?
Yeah.
Okay, and how far from the insertion site is the tourniquet, Lauren? 3 to 5 what?
Inches.
Inches, excellent. How long should that tourniquet remain on that patient's arm?
60 seconds.
60 seconds. See, she ain't playing with y'all. Serious as a fucking heart attack. Okay, and when it comes to the type of fluids, what kind would you like?
Isotonic solution.
Isotonic solutions, and give me 2 examples.
Shit. Point.
You all right? You jamming shit.
0.9, that one. The normal saline.
0.9 normal, 9% normal saline.
And
The other one is real popular in OB.
5% dextrose.
Never. We don't bolus dextrose ever.
normal saline. And then the heck is wrong with me today?
Nothing. You fucking handling the business. You done better than most. What are you talking about?
It's not you got some brain farts.
You ain't got no brain farts. You're working fine. Now, Shonda, on the other hand, is hilarious.
I got the brain for it.
You ain't got brain farts. You got delayed transportation of the answer to the brain. So what do you want? What kind of solution? She got normal saline. What do you want? Since cute hairdo baby just wants to be heard and feel like she's doing something, let's get her a chance in the class, y'all. What kind of fluid, Sugar Muffin?
I would say normal saline.
What you want, little lamb chop?
Lactated ringers?
Yes, lactated ringers. You knew that when I should have came to see my baby.
I would.
I'm sorry.
It's
boo.
okay.
I'm coming back. Okay, so y'all good though, for real. Y'all handling the business. Now this one gonna be hard. Let's see what you do with it. What type of anesthesia might this patient need, Lauren?
She gonna need one of this. Put her down. Sleep.
It was like right there. Always with me.
Just like.
Lashana, what kind of anesthesia? Essence, what kind of anesthesia? Two possibilities. What would you like? Nikaya? Huh? Spinal spinal anesthetic, okay. Nikaya, what would you like, baby? Twilight. What would you like, D? General anesthesia. What would you like, Nadia? General anesthesia. What would you like? My crazy child. What is your name, baby? I know it and I can't.
General anesthesia.
What's your name?
Francis.
I know that. Darden, Miss Darden. What you doing over there? General anesthesia. Miss Darden. Yeah, I called her out. Different.
General anesthesia.
General. Okay. What you want, babe?
I'm gonna go with general.
General. What y'all want? You ain't said nothing yet.
Post I don't know.
Just general must not be right.
General.
She would have said.
Oh my God, I can't deal with y'all. Okay, Lauren, did you know what you wanted yet?
I don't know. You told us that these ones start with like an M, like it was abbreviation. I don't remember the name of it, so. I don't know.
Well, you're absolutely right. I was looking for Mac or General. So if you said General, you did good,
I'm
guys.
talking about that.
Mac is probably the safest, right?
Yeah.
Now, it is monitored anesthesia care, right? So that is, it's not appropriate to use Twilight on this lady. That would be crazy because what are you doing? You're only just, you still got her awake on the table. Like, that's crazy. You're doing surgery, okay? You're not doing this little simple procedure. And it's not going to be quick to do this procedure. So it's MAC, M, capital A, capital C. What is that? That's basically putting people to sleep with propofol. And that's in your procedures packet. Okay. Monitored anesthesia care. Yeah, monitored anesthesia care. So it's going to be using propofol, maybe even a little fentanyl or Versed, Zofran, whatever. But the bottom line is she will not be able to respond to you. She don't need to be awake for this. This is horrible.
That make you still loopy when you wake up, like your head is like.
Everything makes you loopy. It's drugs. So propofol is what we would want for this lady. If we couldn't do that, a general is just as reasonable. It's just a little bit more risk, right? If we do a general anesthetic, what did you have to give her to prepare her for that? Lauren or LaShonda?
A CT scan.
No, everybody that goes to sleep doesn't get a CT. What do we do before we can do any anesthesia because of the number one side effect? First of all, what's the number? What is the number one side effect, Lauren and LaShonda? That's their disease. Y'all don't be trying to take it.
The number one is
Of anesthesia.
Did you get consent before?
I'm gonna try this again. What is the number one side effect of anesthesia? No. Where's my belt?
Over there.
Over there? It is over there. I need to get it because y'all out of control. No. What is the number one side effect, Nakaya?
You could die.
Number one side effect, Essence?
Hyperthermia.
No, that's a complication. That's deadly and rare. What is the number one side effect, D? Glad y'all here today. What's the number one side effect, Miss Darden?
Respiratory depression.
Not at all. What's the number one side effect, Adia? This all in y'all's
I
packet.
was gonna say that.
Not at all. Number one side effect is death. Why would anybody allow you to put them to fucking sleep? Think that through. I'm whooping you for that. What's the number one side effect? She like, I just got here. Don't even try it. It's low blood pressure, hypotension. This patient needs a fluid bolus.
That's what I was about.
Yeah. Woulda, coulda, shoulda. We know.
It's how everything go down.
It's the braids. They're too tight. I don't know. Okay, so listen, y'all. This patient needs a fluid bolus before she could get a general. The number one side effect of any anesthesia is hypotension. Okay, we're done with that patient. Y'all crazy.